Welcome to pharmacology. Sorry, still in the holiday Chinese New Year mood. So today we're going to talk about the route of administration for part 2. Ta-da! Okay, so type of administration of the others which are not covered in the class will be gone through briefly in this particular flipped classroom today. So the first part we're going to talk through is about inhalation, and don't forget a lot of points and information from this class is actually a lot from your common sense, right? So inhalation again has to be delivered, it has to be used to deliver drugs directly acting on the lungs, right? It's the shortest, fastest mode in a way to the lungs. So you need an inhaler. So there's different types of inhaler as seen here, which you'll learn more about it in your pharmacy practice classes and also your pharmaceutical classes about the designs of those inhalers. So again, when the inhaler is used, it requires some coordination, especially for this type of inhaler. So what happens is that the person has to shake it first, press it, and take a deep breath at the same time. So some people would find it difficult, especially for some children or some adults. So they'll need an aero chambers here, which looks something like that, so that they can breathe in slowly after pressing on the inhaler to release the drug. So again, there's certain mask type inhalers as well. So for all the types of administration routes, you need to know what the advantages and disadvantages are, right? So go and figure it out and look up for the answer. Okay, just a note here to be taken that first pass metabolism also occurs in the lungs, but it's mainly due to the action of esterases. So an example would be like cyclosonide, which is actually delivered as a prodrug. And something to note that the cytochrome P450, which is the main metabolizing enzyme available in the human, is actually different isoforms and different expression compared to the liver BS in comparison to the lungs. It's a different isoform. So let's look in detail about cyclosonide. So it's actually a prodrug, meaning originally by itself is actually inactive. However, it can be converted to the active form here by the endogenous array enzymes, esterase enzymes. So another form would be suppository. You should be familiar with this, I hope. So again, yeah, it can actually cause both topical and systemic effect. So you can see here it can be used mainly to deliver laxatives and also in this case acetaminophen, and obviously you know more as paracetamol. So it has actually both effects. So again, you have to counsel a little bit more about the use of suppository if the patient is going to use it for the first time. And when you look at the diagram here, in terms of the anatomy side of the rectal, you can see it's actually full of blood vessels here. So due to this advantage, an anatomical advantage, you can actually deliver drugs for systemic effects. So general advantage and disadvantage of this route of administration, quite direct, right? So basically it's easy to be administered, especially to children if they didn't want to take a tablet, and obviously they won't, or to take a syrup, which they might find the taste a bit weird sometimes. So obviously it's not the most comfortable way as well. So there are other types of suppository, so some through the vaginal, right, and also the intraurethral. So again, for some localized action, mainly again, it's not the most pleasant way of administering a drug. So it can be for antifungal, localized effect as well. Go find out more about these drugs, okay? Right, so another one would be transdermal, basically through the skin. So again, it can actually be used to deliver both topical and systemic effect. So the most famous and one actually would be nicotine patch and also fentanyl patches. So these patches, the good part of it is when you look at the label, you can actually realize it can actually deliver drugs for 72 hours. So yeah, they can avoid taking the tablet and so on, but the effect of the drug can last for 72 hours. So there's some good part of it, of course. So the patient doesn't have to remember when to take it, but just to remember when to put on the new patch and obviously to remove the old patch, right? But again, some people might be a bit sensitive to the sticky adhesive material which is on the patch, but again it's quite rare. Right, so factors that can actually increase the absorption of the drug, which actually interfere with the release profile a little bit, such as the inflammatory of the site that the person is actually putting the patch on, because inflammation, obviously there's more blood vessels at the site in a way which increases blood flow. If the vehicle which you put in is oily, again, oily stuff can go through your cell membrane faster. Obviously rubbing as well, which increases the heat locally and again causes more blood flow. Hydrated skin, so if the skin is more moist, again easier for the drugs to pass through. So this is a summary of everything that you should know, and remember to make a table of the advantages and disadvantages for different routes of administration. Again, use your common sense. So don't forget whatever that we learned about bioavailability. This is just again a very short overview again as a revision. So for IV form, obviously the plasma drug concentration will be about 100% at its maximum level in a way upon administration, and the level will slowly decrease due to the distribution of the drugs to different parts of the body, and also metabolism and elimination process. Other routes of administration will take some time for the plasma concentration to increase to its maximum point, and depending on the bioavailability of the particular drug, so it'll influence in a way the maximum plasma drug concentration. So this is the text for the explanation of the graph just now. And please go through this particular case study which is found online, and we'll discuss more in class. That's it for now. Ta, enjoy.